Hi, Dr. Raj here, and today I'm going to be representing the American Academy of Sleep Medicine, and today's presentation is going to be COVID-19 and sleep questions from the public. And as I mentioned 1 second ago, my name is Dr. Raj, and this is always going to be the awkward part, which is talking about yourself, but they did want to mention me to mention a couple things. So I am a fellow of the American Academy of Sleep Medicine, and I'm one of their national spokespeople. And I am very, very proud of this. And I just want to say thank you to the AASM for inviting me to do this talk because it is very timely. And these are very, very practical questions that my own patient has been asking me. I work at the University of Southern California, USC. I'm actually certified in internal medicine, pulmonary, critical care, and sleep medicine. And I am the Associate Program Director for the Sleep Medicine Fellowship, as well as the Assistant Program Director for the Internal Medicine Residency. And as you can see from my picture right there, I'm the smiling person sitting on the couch, that I'm the co-host of a show called Chasing the Cure with Ann Curry. And I'm very, very proud of this and very, very proud of what the show represents. If you want to follow me, I gave you a couple of my media handles on Instagram, Twitter, and Facebook. And before I forget, this is a very special slide to me. I want to say thank you to my amazing sleep fellows. And the first person is Dr. Sahar Samani, and the second is Dr. Anish Patel. And the reason why I'm putting this picture here is because not only are they amazing fellows, they were very excited about this presentation. In fact, help me get the evidence-based medicine, which we all want to hear when answering these questions to the public. So a big round of applause, they're not going to hear your clap, to these two fellows. So about the questions. The following questions were submitted by the public to the American Academy of Sleep Medicine. The AASM is a professional society that sets clinical standards for patient care and accredits sleep disorder centers. So let's go to the questions. So the first question is, now I'm going to be playing with my mouse a little bit to make sure I can see the whole question, but does having sleep apnea make me more likely to get the coronavirus? Second part is, will I be more likely to have severe complications if I get the virus? So right off the bat, I'm going to say that this is a very spicy question. Why? It's because it depends on how you interpret it. Now, when we talk about sleep apnea, I'm going to assume that the person asking the question is referring to obstructive sleep apnea. But as many clinicians know, there's a broader topic here, which is going to be what? Sleep disordered breathing. And that involves things like obstructive sleep apnea, things like central sleep apnea, and also something called OHS. That stands for obesity hypoventilation syndrome. So if you were to ask me, and let's answer the question referring to the most common, which is OSA, obstructive sleep apnea, does OSA directly put you at risk for developing coronavirus? And the answer is no. There's no data that OSA by itself puts you at risk. But let me take a couple of steps back. Let me ask you the question that if I ask people with OSA, are they more likely to be young or more likely to be older in age? What is the answer? Oh, you got it, and you said it. They're going to be older in age. And when we talk about COVID-19, does that affect who more, the young or the older? And you know it's going to be the elderly. So just based upon age, you're in that group. And let me say this. When we talk about treating obstructive sleep apnea, and I want to treat a mild amount of it. And for those who don't know, how do I call it mild obstructive sleep apnea? That's based on something called the AHI, the apnea-hypopnea index. And if your AHI is somewhere between 5 to 15, I may treat even a mild amount. But when do I treat a mild amount? Well, when you have what we call comorbidities. What are they like? People who have heart disease, congestive heart failure, coronary artery disease, other diseases like having high blood pressure, we call that hypertension, diabetes. And when we talk about or respiratory illnesses or arrhythmias like atrial fibrillation, and if you have any of those things that I just mentioned, do they put you at a higher risk for complications or getting COVID-19? The answer is yes. So is there a direct relation with the obstructive sleep apnea? The answer is no, not at this point. Things are always changing. But are you going to be at higher risk because of the comorbidities that you share because you are higher in age? The answer is yes. So it depends on how we ask the question. Will I be more likely to have severe complications if I get the virus? Well, that's a very individualized question because people are using CPAP, continuous positive airway pressure, or treating their sleep apnea because of their different comorbidities. So if you have bad respiratory issues, or if you have bad heart disease, or because you are older in age, you might be more likely to develop complications of COVID-19 than other individuals. So the bottom line point is, and I'm going to say this probably for every question coming up, is that if you have obstructive sleep apnea or any type of sleep disordered breathing, and you want to know if you are at risk for COVID-19 or its complications, you have to contact your primary care physician, your sleep physician, to find out where do you fit on that spectrum of disease and how much do you need to worry about it. Those are really good questions to set the tone right off the bat. So with that said, let's go to the next question. During this outbreak, should I stay home if I have sleep apnea? Now, this is going to be probably the most easiest question I get all day. And the answer is yes, stay at home. And I think regardless if you have sleep apnea or not. So I am very passionate about this. When we talk about, what can we do as society, as physicians, as the general public to help out what's going on, it's staying home. And I just wanted to take a couple step back to say a few things is that, I am a pulmonary and critical care physician. And, over the last week, I've been contacting my colleagues, my friends, my mentors in New York, New Jersey, on the East Coast, Philadelphia, and it's a war zone out there, especially in places in New York. And I have people that train me, that I work with, that are swamped. And if I could do anything to help them, I just want to do it. And what we know, what does the evidence show, is that by social distancing, by staying home, by not going out if not necessary, does so much to help the spread when we talk about COVID-19. And I know that everyone kind of, hears the phrase flattening the curve, but that's what we need to do. Because when one person gets it, it branches out to another 5 people, then each of those 5 people to another 10 people. So we do need to flatten the curve. We do need to stay home. So regardless, whether you have insomnia, restless leg syndrome, narcolepsy, obstructive sleep apnea, if you could stay home, please stay home. So I think this is a timely question. And the answer is yes, if possible, please stay home during this time. So let's go to the next question. Wow. So what is a ventilator? Is my CPAP machine a ventilator? I'm going to say that I don't think there's going to be enough time in this video for me to answer this question because I'm going to get really into it. So when we talk about what is a ventilator, well, let's take a step back. I know this has been my favorite phrase for the last couple of questions, but we do need to take a step back. And how do we breathe? How are you breathing right now? And the way we're breathing, when I talk about physiology, is negative pressure ventilation. What does that mean? Is that if you could see my lungs, I know you can't see them, there's something called the pleura that surrounds the lungs. And when I take a breath in, what happens is that the pleura develop this negative pressure. And as it gets more negative, it opens everything inside my thorax, including these little alveoli that make up my lungs. And what does it do? It makes the alveoli have negative pressure inside, so it kind of serves like a vacuum to suck the air from the atmosphere into my lungs. This is called negative pressure ventilation. That's how I'm normally breathing. That's how you're normally breathing. But the opposite of that is positive pressure ventilation. And when we talk about positive pressure ventilation, that's usually what I think about when I use the word ventilator. So let me just take one step back because there's always that one person watching this saying, is he going to mention a negative pressure ventilator? And there is such a thing. I don't know if many of us remember this, but there's something called the iron lung. And this was during the days of like polio. And there's not many iron lungs left out there. So I'm going to focus on what we commonly think, which is a positive pressure ventilator. And there are really two types. So I'm doing this little diversion thing with my hands. You could have a non-invasive ventilator and an invasive ventilator. So what is a non-invasive positive pressure ventilator? It means that you are blowing the air into the patient. And instead of having something invasive, like a tube going through the vocal cords into the lungs directly, you're going to wear a mask of some kind. And that's why it's called non-invasive ventilation. And when I think about non-invasive ventilators, there are two subtypes. One will be hospital-based non-invasive ventilators and home-based. And even though we use the same names to describe both, CPAP or bilevel, there are two different types. One are the inpatients that I use in some of my patients who are in respiratory distress, where I want to do something non-invasive. Then the ones at home is what many of you think, which is a CPAP machine or a bilevel machine to really treat the upper airway obstruction up here. And it's very important to realize this because whoever asked this question is spot on. There's a lot of, terminology that we use that people are confusing what are they referring to. So when we say the word CPAP, that's continuous positive airway pressure, describes how we deliver the breath. It's not the mask, it's how we deliver the breath. If you have a bilevel machine, it means there is a way we deliver the inspiratory breath and a pressure that we deliver the expiratory breath. So that's called a bilevel machine. If we are now talking about an invasive ventilator, that means I'm taking a tube, what we call an endotracheal tube, and I'm putting it through the vocal cords and you're going to go in the lungs. I only use this terminology when I'm in the medical ICU, when patients come in with respiratory failure. They're hypoxic, which means low oxygen. They're hypercapnic, which means high levels of CO2, or they're going to be in respiratory distress. So now that we answered that first question, I know that was a mouthful. Hopefully you can watch this video over and over again to get all that. But is my CPAP machine a ventilator? See, once again, for the non-invasives, there are two types: the hospital non-invasive ventilators and a home non-invasive, which is basically what I think this person is asking, my CPAP machine. And the answer is that I don't want to confuse you that this is a ventilator, because when you use your CPAP, you're using it to treat one thing at home, that is your obstructive sleep apnea most of the time. But if you're using a CPAP machine because you're in respiratory distress, because you have a COVID-19 infection, that scares me because that's not the ventilator you should be using. And this is the time that you need to pick up the phone and talk to your primary care and talk to your sleep medicine doctor to find out, wait a minute, why do I feel like I'm using my CPAP machine or someone else's CPAP machine or requesting a CPAP machine because you're short of breath? So these are great questions. And please, the take-home message is don't confuse your CPAP machine when we refer to invasive ventilators in the medical ICU or even non-invasive ventilators that we're using in the hospital. And why is this important? And I can't stress this enough. Is there a shortage of ventilators, invasive ventilators in the United States? The answer is yes. It's scary, but not all of the states are affected equally when we talk about COVID-19. I think the last time I read, about a third of the country don't have what we're going through in places like Louisiana and places like New York, New Jersey, and LA, and obviously in Washington State. So there are ventilator shortages. There are shortages of amazing ICU nurses or shortages of amazing respiratory therapists to help us and ICU doctors. So when we talk about, what's happening as a critical care doctor like myself, we are using the in-hospital non-invasive ventilators and switching them in the software to use them for invasive because there is a shortage. And it is scary that if things don't start improving, that who knows, maybe people will start using their home CPAP and bilevel machines to help out people in respiratory distress. So hopefully we're not going to get to that point, but this is a great question, and I truly hope I got a chance to answer it. And sorry for the answer being so long. If I do have the coronavirus, will CPAP help me treat it? Wow, you guys are really putting me on the spot today. So once again, this is going to be a spicy question, because if you're asking me one-dimensionally, does CPAP treat coronavirus? The answer is no. CPAP is, assuming home CPAP, is only to treat one thing, probably your obstructive sleep apnea. But the question becomes is that, if you don't use your CPAP, and I know that wasn't the question, if you don't use your CPAP, what could happen? Well, we know that we want to stay healthy. And the pillars of good health are going to be diet, are going to be exercise, and of course, it's going to be good sleep. And one of my favorite phrases out there is that in order to get good sleep, you need the right quantity of sleep and the quality of sleep. And if you're not using your CPAP because maybe you do have obstructive sleep apnea, then you're going to further weaken your immune system. And if you do have coronavirus, or you're worried about getting coronavirus or any virus, you're definitely going to be more susceptible. So the answer is that coronavirus is not treated by CPAP, but now it becomes a very important question is going to be, should I continue using my CPAP? And what are going to be some of the consequences to people around me if I do use my CPAP? But if you don't have coronavirus, definitely continue using your CPAP at this time, because you do want to get the good quantity and quality of sleep. Now, it says, would bilevel PAP be more effective than CPAP? I assume they're talking about if I'm treating coronavirus. And the answer is, once again, we don't treat coronavirus with bilevel and CPAP when we talk about patients at home. When you're in the hospital, that's a whole different story. And where does this come from is that when we talk about using bilevel, and why would you use bilevel? I assume that it's probably because some patients may have a high CO2 level and you want to blow off the CO2, or in some cases it may be more comfortable, but you don't want to confuse this question from inpatient and outpatient. So when we talk about inpatient medicine, right now it's a tough time, because when we talk about patients that come in with COVID-19 and they're in a medical ICU setting in a negative pressure room, that if they're in respiratory distress, and I hope these patients won't be in that if you're using things like bilevel or CPAP in these patients in respiratory distress, you may actually, spread the virus and may infect other people in the room. And that's where it's very scary. And whether you're in a hospital, the same thing goes to my patients at home. If I'm using a CPAP and BiPAP and I have COVID-19, am I spreading it? And I would just say this now, because I know I'm going to forget to say it, is that in the hospital, in the medical ICU, is that if we all had the appropriate personal protective equipment, PPE, that it really wouldn't matter as much if you're in a negative pressure room, everyone had the best, perfect, personal equipment, because no one will really be affected if it spreads. But the problem is not all of us have that equipment, and there is a risk. And that's why when you talk about the inpatient management, what we try to do is, try to avoid that CPAP and BiPAP, which makes it really scary for the poor patients, because we are putting you on the ventilator, because the fact that it not only will help you, but prevent the spread of the virus. So this is a very timely question. And my advice to whoever asked this question is, remember, these terminologies, as I mentioned already, can be used in both the inpatient and outpatient setting. And who would make that decision, whether bilevel or CPAP would be better for you for your sleep apnea by itself? That would be your sleep physician. But once again, that we are not treating the virus directly. And if you're using these things because you're short of breath, please inform your doctor, because you may need to go to the hospital. All right, maybe this one's going to be a little easier for me. Question number 5, if I do have the coronavirus, will CPAP drive the virus deeper into my lungs? Okay, the answer is no. Right now, there's no data to state that if you do have coronavirus, that the CPAP will drive it into the lungs itself. But the question now becomes if you're at home and you have other people in your house. And that's the hard part about answering questions, because each question is individualized. Each patient is individualized. And like I alluded to earlier, if you know you have it and you're at home, by wearing that mask, you worry about spreading the virus to other individuals in the house. This may not be a big concern in someone who's by themselves or someone who has a very big house and is able to isolate themselves. But there are so many different living situations throughout the world, throughout our own country, that is a very important thing to ask your doctor. And maybe if you do have coronavirus and you're not short of breath and you're doing well and your sleep apnea is on the milder side, well, this may be a great time to ask your physician, are there other things I could do to treat the obstructive sleep apnea that's not going to be using a CPAP device and mask? And people already asked me, well, what things are you referring to? Well, maybe this is a time to look into positional therapy. And I already hear the question you're going to ask me, what is positional therapy? Well, some people, what a surprise, have sleep apnea more on their back. And because of this, there are going to be simple things, and, someone's going to roll their eyes when I say it. I already know it, as, sewing tennis balls in the back of your shirt, to more expensive devices that will actually, monitor your sleep and make you go on your side. Maybe a dental device, will be something to look into if you have one already for travel. So maybe this is the time to discuss this. Hey, I have coronavirus. I'm doing well. I have a CPAP machine. There are other individuals in my house. Doctor, what do you suggest? But that is a great question. And I noticed that this is a two-parter. So this is, will this cause me to get pneumonia? So I'm going to answer it this way, is that no, wearing a CPAP machine does not cause your COVID infection to get pneumonia. But what I do want to say is that if you were to have the consequences of COVID, what am I seeing as a critical care pulmonologist in the hospital? I see people get these secondary pneumonias. So what happens is when any virus, including COVID-19, it does a number on your immune system. It actually will make you more predisposed to other pneumonias that they come from the community. We call them community-acquired pneumonias. If you're in the hospital, we call them hospital-associated, or if you're on the ventilator-associated. And we do worry about that. And another manifestation you can get from COVID-19 in the lungs is something called ARDS. And I'm sure many of you may have heard about that. It's called acute or adult respiratory distress syndrome. And it's very, very serious. And this is what I'm doing as a pulmonologist right now in treating many of my patients who unfortunately develop ARDS, or many of my patients develop, and you're going to hear this in the next couple of days to weeks, this cytokine storm that happens, all this inflammatory response that occurs in people who have this COVID-19 infection. And it's that combined with the ARDS, combined with secondary pneumonias, that are very serious when we talk about these patients who are at the inpatient. And of course, let me just say that, I'm talking about the worst of the worst, because I am in the ICU, but of course, many patients will have just upper respiratory tract symptoms. Some, of course, will be asymptomatic, and we don't want them to go on to be in the ICU. But I just want to make sure when I saw this question, I hear the word pneumonias, that I do address about what are some of the complications in the severe sense of people who have COVID infections. But to answer the question directly, if you're talking about in the outpatient setting, no, CPAP will not drive the virus into your lungs. No, the CPAP in itself will not give you a pneumonia. Question number 6. You know what? It says question 6, but it feels more than question 6. Okay. If I have the coronavirus, is there a risk that using CPAP will infect others around me? And if so, why? Wow. Whoever asked this question read my mind like 3 questions ago. So the answer is yes. Now when we talk about this, let's talk about it at home. So, 30 million plus people have obstructive sleep apnea. I'm sure a lot of those individuals are using CPAP, continuous positive airway pressure. So how do you infect others? Is because it's a non-invasive positive pressure ventilation. And because it's non-invasive, you have to wear an interface, whether it's going to be a nasal pillows, a nasal mask, a full face mask, there's always going to be leak. And because there's going to be leak, that's why the virus can spread, and it can definitely affect others. And we take this knowledge in the outpatient setting to say if there's other individuals around you, especially because we're isolated now and everyone has a different living situation. People share rooms, So yes, I would be very cautious. If you think you have it, please contact your healthcare physician right away to find out what is the best thing to do. And maybe doubling back where if it's indicated, maybe not using a CPAP device for certain individuals might be the answer. Once again, positional devices. Once again, lifestyle modifications. Once again, these dental devices. So who knows? I just wanted to bring that up. And this is another reason why mask fitting is so important, because even if you wear a full face mask, you do get some leak. So these are going to be what we talk about in the outpatient setting. And once again, in the inpatient setting, if you are unfortunate to be in the medical ICU, we're not using CPAPs and BiPAPs to managing these patients because of the fact that you may expose other healthcare workers in the room. And that's why many individuals were using things like high flow nasal cannula. And I'm sorry for bringing up all these words and terms. I know it's frustrating. High flow nasal cannula is going to be giving you oxygen in a high flow. Flow is volume over time. We're talking 30, 40, 50, 60 liters per minute. On top of that, adjusting the percent of oxygen. And we do use this sometimes in patients who do have COVID infection who are hypoxic. We put in the high flow nasal cannula and they'll wear probably an N95 mask over that. But then because of the risk with BiPAP and CPAP, we'll probably end up putting them on an invasive positive pressure ventilator. And hopefully they won't have the manifestations of ARDS and other things we mentioned. So great question, a very timely question over here. I have the coronavirus. Should I stop using CPAP so that I don't infect other people? Wow, I think because I have so much passion for each question, I'm answering the whole slide deck in one shot. So the answer here is that you need to talk to your primary care physician right away. That, I think the person who asked this question was aware that there is data out there that, because of the mask leak, that there are other people in the household that will be at risk. And I got to tell you, this is one of the scariest things for me. Because, when I'm not wearing my sleep medicine hat, I am wearing my pulmonary critical care hat. I guess mask is the right answer too. But it's when I come home. I mean, who I love more than anything, and I love my wife, and I have 3 beautiful kids. I can't see my parents right now. And I really, worry that more than anything in the whole world. And I'm glad that someone brought this up about, caring about the people you are with. And anything you could do to help spread that, virus to other people is so well appreciated, which is why, once again, social distancing is so important. But yes, I would contact your primary care physician before stopping it, because there are so many things that will have to play a role. And of course, one thing we're not talking about is we're just saying I had coronavirus, but remember, it is a spectrum disease. Are we talking about the asymptomatic? Are we talking someone with upper respiratory tract? Or are we talking now the lower respiratory tract? Where I am worried about individuals getting very sick. And I know this isn't a question, but for those who don't know, what have I seen clinically when people have coronavirus infection is that it's bimodal. There's like 2 phases. There's the initial phase where everyone hears it on the news. You have cough, you have shortness of breath, you have fevers, and that's one part. But there's this point where all of a sudden they become very, very hypoxic, meaning their oxygen levels get very low, and it happens very rapidly. And when they decompensate, that's where I'm seeing most of it as a pulmonary critical care doctor. So there are 2 phases of it. So, when we ask these questions, it really depends on how sick you are. And their default answer is please contact your healthcare provider to know what the next best thing to do is. Question 8. If I had the coronavirus, how do I clean and disinfect my CPAP machine, mask, and accessories? Okay, there's just two parts to it, but let's answer the first part. Once again, this is probably the easiest question I got all day. So the answer is it's going to be recommended by your DME company, which stands for Durable Medical Equipment. They're going to tell you how you need to clean your machine. And when we talk about how, the answer is going to be soap and water. You know, I'm oversimplifying the word soap, but yes, just some simple soap and water. And when we talk about how often you need to do that, I don't know if this is going to be the next question, but I'll just say it now. Usually it's going to be once a week. You know, is it wrong to do it every 3 days with soap and water? The answer is no. Are there people out there who are probably doing it every day? The answer is probably yes, but there's no downside in doing that. But don't forget not only to focus on cleaning your machine, but it's going to be generalized hygiene in general. It's going to be, disinfecting your hands, washing your hands, touching all these things. I think a big thing right now I've noticed is cell phones. And I have to say I'm guilty that, you have your cell phone, you lay it down, you're touching it, you give it to someone else, hey, take this picture. I mean, this is another way to transmit viruses. So don't overly focus on your CPAP machine and ignore all the other appropriate hygiene that you need to have to prevent you from transmitting the virus. Will a CPAP cleaning machine disinfect my CPAP device and mask? So this is a great question, regardless of a COVID-19 outbreak or not. Many of my patients have asked me about UV light and ozone. And I'm not going to use brand names out there. I know we've all seen these commercials on TV, but those are the two ones, I believe, ozone and UV light. And I have had, tons of patients ask me, is this just as good as cleaning with soap and water? Is it better? And the FDA, and I got a lot of my information here looking at the FDA site, that these are not approved machines. There are actually people out there that are complaining of some respiratory symptoms. I believe it was like asthma-like symptoms when using things like ozone. And there are also side effects when you use UV light. So it does look tempting when you see a little box and you put it in the box, but know that these are not FDA approved. And especially right now, I would say soap and water, soap and water. Because you use soap and water, does that 100%, protect you from coronavirus? The answer is no, but it's simple, it's proven, it's what the DME companies, know is how we should clean our machines. So please stick to what we know. All right. Great question over there. I'm going to give that question a thumbs up because it's super practical. I really love that question. Question number 9. If I have the coronavirus, should I replace my CPAP accessories more frequently? Really good question. So, here at USC, I have an amazing sleep center, and I can't say enough to the wonderful staff that I am privileged to work with. And they've been getting phone calls like this all the time. So once again, I'm going to go a little astray and say, what are we doing here? I don't know if it's going to help other people. We're definitely doing telemedicine here at USC, both from a sleep standpoint and a pulmonary standpoint. And it's really been helpful. I've been getting so many questions, not just about sleep apnea. It seems like today's sleep apnea day, but, many people have anxiety. Many people have stress. So you can imagine all the insomnia questions I'm getting. And of course, just being at home and with the isolation and the social distancing is that everyone's sleep schedule is topsy-turvy. And just speaking of myself, I have kids at home. And so it's tough. And so my sleep center is getting a lot of questions. And so we're trying to get to all of them. So when I hear this is a very common question I get all the time. And the answer is no, is that, when we talk about, the tubings, the mask, and of course the filter, and I can't say enough about the filter, is that, you want to do it to the most appropriate recommended of your DME company. You don't need to change your filters more than necessary. You don't need to request more masks or more tubing. Do your hygiene using the soap and water, but do it as it's recommended. And one thing I can't mention enough on is when talking about these filters. And when we talk about the filters, I may have to, I hope I'm not stealing my own thunder, but the answer is most of my patients, when I say, what about the filter? They're like, what? my CPAP machine has a filter. And so, yes, they do, and it does need to be changed. And hopefully you're getting a supply of filters, from your DME company. So the take-home message here is that if you are concerned about how frequently you should be getting your accessories, that you're getting the right amount, you're getting the right amount of filters, or when you should be changing. Because remember, there are many CPAP machines out there. There's going to be a ResMed and a Respironics and the Fisher-Paykel. And, all of them have different filters. So please ask your DME company about what should I do with your device. But to answer your question directly, no, I wouldn't change any accessories or filters more than the recommended amount. Are there any additives or chemicals that I should use to clean a CPAP machine during the coronavirus outbreak? Well, I think this is an easy question now, which is the answer is no. That this question actually scares me. I'm sure there are people out there that are maybe doing their own thing. And what's a good example of that is when we talk about hand sanitizers. Now, once again, I apologize for going a little off topic, but here's the analogy, is that, when the outbreak first happened, no one could get toilet paper. No one could get hand sanitizers. And people were selling hand sanitizers for an obscene amount, and there were individuals making their home hand sanitizer. And I'm not against that, because I'm sure there are people watching this right now that have some special recipe to how to do it. But, mixing isopropyl alcohol with aloe vera in different portions. I don't think all of us should be making our own hand sanitizers. And sometimes there are bad things that can happen. And so during a time like this, when there's not a lot of evidence-based medicine of what to do, people will try different things. So I'm not surprising. I would be horrified if someone put things like bleach or put other things or other chemicals in their CPAP machines, because remember, they're going in the lungs, And just to say something, because I don't want to get anyone angry at me about the hand sanitizer comment, of course, if it comes down to zombie apocalypse and there's no hand sanitizers anywhere, sure, go ahead and use it. But my recommendations are to try to get some within reason if they're not too expensive. Just like here, please just stick to what's recommended. Don't add anything else. I only see horrible things happening, but that is a great question. What do I use in my CPAP humidifier? Oh, if we don't have distilled water. So once again, this has to be at least one of the most common questions that I've been getting from many of my patients who have obstructive sleep apnea, because it's not easy to get distilled water right now. So really easy answer. You could just use filtered water, you could use boiled water, you could use tap water. So what is the reason why we always say use distilled water is because it could clog up the filter. But, in terms of using either tap or filtered or boiled water, it's not going to actually put you at a higher risk for any type of infections or anything like that. The only problem is you may have to clean the filter out a little bit better, but those are my recommendations. We've been using that with our patients and telling that to my patients. So this is going to be one of the most practical questions that we've had today. Great job, whoever had this question. 2 thumbs up. Is humidified air better than dry air for preventing the spread of coronavirus? Oh, okay. This doesn't have a lot to do with sleep apnea or sleep medicine, but I'm going to answer this one. So let me make it as an analogy answer. So I know we've been comparing COVID-19 to influenza virus infection quite commonly, So if I were to ask everyone listening today, when do we worry about getting influenza virus? Is that more during the summer or the winter? What would you say? Probably the winter, right? And one of the main reasons why we don't see as much during the summer, well, probably is because in the winter it's cold and everyone's together in the house. They don't want to go outside, sure. But also it is some data out there for viruses that they don't do good when it's very hot outside, when it's very humid outside. They don't live as long. So I will agree with that statement, but let me just take a step back and say, I don't think, having less humid air or being a little colder is going to, prevent any viruses. I don't think the answer is humidity. It's going to be social distancing and all the other things we do. But this is a good statement. And in broad strokes, yes, viruses don't do as well in humid air and in hot weathers. But this is not the answer to stop the spread or to cure coronavirus. But great question over there. And you kind of put me in my place. I kind of almost choked on that one there. Okay, let's get another one. Question number 13. If I develop coronavirus symptoms, should I stop taking a medication? Such as Ambien, trazodone, or ibuprofen. Okay, so finally we have an insomnia question. And I'm going to tell you, as a sleep physician, many people have been sleep deprived for a variety of reasons. Insomnia, I'm getting so many questions about that. So this is very timely. And you know that I'm always going to have to say, when it comes down to treating insomnia acutely and chronically, it's all about 3 letters, CBT, cognitive behavioral therapy. But, I do have many patients on different types of medication. And I would say this, that, there are certain medications, and I'm going to use medical words here, so I apologize. If you're on a benzodiazepine, things like lorazepam, like Ativan, diazepam, Valium, alprazolam, Xanax, that, they all can make you a little sleepy. Some people do take it as a sleep medication at night, and you're taking this long term. You do not want to cold turkey these medications. There are some medical consequences. When we talk about drugs like Ambien, and I'll throw out some more brand names, Sonata, Lunesta, they do belong to the benzodiazepine family, but they really specifically work on one receptor. And, just in case there's some medical students listening, they work on the alpha receptor. And, I still say that I would be careful stopping these medications for a variety of reasons, one being some rebound insomnia, including other things. So I think the take-home message is, if you are taking a medication, you definitely should talk to your primary care physician, your sleep physician, before you just stop it. Trazodone is another very common medication that we use and patients are taking when we talk about having insomnia. So please let your doctor know that you're considering stopping it, and they could tell you not to, or come up with a way that you could slowly taper off the medication. But let me just say something else as a pulmonary critical care doctor, that, if you're having shortness of breath, if you have a COVID infection, you're having trouble breathing, I get really scared if you're going to be taking Ativans and Ambiens and trazodones and Benadryls because of its effect on the respiratory drive. So, if you're having trouble breathing, that is a red flag to call your primary care physician. And yeah, I don't think that'd be a great time to take your sleeping aids. I just want to say that. Ibuprofen, that came out of nowhere. So when we talk about ibuprofen, many people, when the outbreak first happened, asked me if I'm having symptoms, like fevers or aches, can I take things like acetaminophen, we call that Tylenol, or Advil, ibuprofen. And, there was some data that came out that, made people a little scared at saying people who take ibuprofen may worsen the symptoms, lack of a better term. But, the WHO, CDC, made a statement saying that there is no concrete data or proof to support these claims. And I would say this much, if you get to choose, Tylenol or Advil, meaning acetaminophen or ibuprofen, yeah, sure, I would probably err on taking the Tylenol. But if you're having, if you have osteoarthritis or aches and pains, I wouldn't shy away from the ibuprofen, you know what I mean? The most important thing is to realize, if you're taking a lot of these medications, are we missing something? And what are the side effects of taking ibuprofen? And those side effects are, it does a number on your kidneys if you take too much of it, and a number on your gastrointestinal tract. They can cause things like gastritis and ulcers. But then on that note, it's such a confusing and scary time. Anytime you turn on the TV or you go to a website, there's a new medication that we're worried about, and for many of the cardiologists out there, I'm sure many of their patients are asking about things like what we call ACE inhibitors, or ARBs. ARB stands for angiotensin II receptor blockers, because of some thought that maybe these medications, ACE inhibitors and ARBs, could maybe put you at a higher risk, but once again, it seems like every time you turn on the news, there's a new medication. A big thing that, I've been asked multiple times more as a pulmonologist is, what about steroids? What about prednisone? And, the data right now states that we should avoid, glucocorticoids, steroids, prednisone in patients who have, COVID-19 disease, unless you're using it for other reasons, like such as if you have what I mentioned earlier, which is ARDS, maybe you should use a steroid then. Because one thing I did mention is that there's 2 phases of this disease, and definitely in what I call the first phase, where you're having just a cough, the fevers, you know what I mean? That I definitely wouldn't give you steroids, but who knows when you're hitting this, when your immune system and all these cytokines are in disarray, maybe there would be a role for using steroids then. But the answer is, if you have any medication nowadays and you're curious about is it safe or not safe, what I should be doing, you know what I'm going to say. Please call your primary care physician, healthcare providers to try to get the right answers. But this is going to be a great question. I have a baby with enlarged tonsils causing sleep apnea and severe symptoms with colds. Sorry to hear that. Are children with sleep apnea at a higher risk than others? And the answer is that there's no data right now to say they are at a higher risk. And let me answer it in a broad strokes answer, which is when it comes to COVID-19, from what we know at this point, who is going to be at higher risk? Is it going to be young individuals? Is it going to be infants and toddlers? Or is it going to be the elderly? And the answer is the elderly. So, but, anytime you turn on the news, there was a story recently about an infant that passed away, and it makes me so sad. So you've got to be careful. You've got to be careful, whether it's be your own loved ones or even when I make any statements, because things do change. And this is a very, tricky, aggressive virus that's doing a number on us. But no, to answer your questions directly, it does not. When we talk about infants and talking about newborns, I have a 5-month-old. Her name is Sadie. She is the most adorable little girl in the whole world. And, when this outbreak first happened, she developed RSV. And the reason why I'm mentioning this is because, anytime you have a sniffle in your baby or yourself, everyone thinks they have COVID nowadays. But remember, not every sniffle in a baby means they have COVID. Babies, meaning, infants and newborns, they make a lot of noises when they sleep. It doesn't mean something's wrong. And I definitely would talk to your pediatrician. And you can imagine how scared I was, when we didn't have a diagnosis with this, outbreak happening, that for once I was, wow, RSV, I'm glad it wasn't COVID. And I'm really happy that my baby did well, because there are, when we talk about respiratory syncytial virus, there are people that have kids that don't do well with it, and I do, and it is sad. But remember, common things are common. If you are having any type of infection or suspect any type of upper respiratory tract, or you're worried about a cough, please let your primary care physician, pediatrician know about this. But the answer to your question is no, not at this point. Oh, wow. I was kind of in a roll. I'm ready for question 15, but I guess there was only 14 questions here. But here are some resources. Please, I can't tell you enough that people at the CDC are just amazing, as well as the World Health Organization. Here are going to be their websites. And for more sleep information, please go to sleepeducation.org. And I believe I put this last slide in here. Let me see if they kept it. Oh, there it is. I want to say thank you. I want to say thank you to the American Academy of Sleep Medicine for giving me this opportunity. I want to thank everyone out there for listening. And the most important thing is, I just want to say thank you to all the healthcare workers, all the respiratory therapists, all the nurses. I can't even list everyone who are doing so much during this outbreak. I just really am so proud of everyone and how it brought us together and not apart. And these are if you want to follow me on social media, this is my Instagram, Dr._Raj_. I'm also on Twitter and Facebook. And if you go to my educational website, it's called beyondthepearls.net. I have free videos where I talk about positive pressure ventilation and sleep apnea and all these different things. So it's a free website. Please go to it. If you want to see me on any of my television shows or programs, I do have a media website at rajdasgupta.com. Thank you for everyone for listening today. I wish you all the best during these very difficult times.